The broadcast is now starting. All attendees are in listen-only mode.
Good morning. Today is Thursday, September 1st. I am Donna Will, Professional Development Coordinator for the Developmental Disabilities Administration. We welcome you to DDA's webinar on Family Supports, Community Supports, and Community Pathways Waiver Renewals 2023. Our presenters for today are Rhonda Workman, Director of Federal Programs and Integrity, and Nova Evans, Deputy Director of Federal Programs and Integrity. Before we begin, I'd like to go over a few things about the webinar. All participants are in listen-only mode. There are two options for listening to the webinar, by computer and by phone. And if you have trouble hearing, you can try switching by clicking on the appropriate button on the audio section of the webinar panel. There is one handout for the webinar, and you can find it and download it from the handout section in the panel on your right. We will be recording the webinar and we'll post it on YouTube and on the DDA website. Questions can be typed in the question or chat box, and we will get to those at the end of the presentation. So now I'd like to introduce Rhonda Workman. Good morning.
Good morning, Donna. Thank you so much. I'd like to thank everyone for joining us today as we discuss the waiver renewal updates for the Developmental Disabilities Administration 3 home and community-based waivers that we operate on behalf of Maryland Medicaid. We're grateful for the opportunity to share information with you today and at your time. My name is Rhonda Workman. I am the Director of Federal Programs and Integrity, and I'm pleased to have Nova Evans, my new Deputy Director of Federal Programs and Integrity, with me today as we share important information with you about the upcoming waiver renewals. As noted on this slide, the purpose for today's discussions includes to share updates on the DDA home and community-based waiver renewals, including the Family Supports Waiver, the Community Supports Waiver, and the Community Pathways Waiver. We will also share an overview of federal waiver renewal requirements and share some overviews of proposed waiver renewal changes. And then finally, we will share information related to the public comment process. Next slide, please. So let's start with our waiver overview. Next slide, please. So the waiver programs provide home and community-based services to support participants and their families as the participant works towards individually defined life outcomes and goals, self-determination, community living, socialization, and economic self-sufficiency. The Developmental Disabilities Administration administers 3 Medicaid home and community-based waiver programs on behalf of Maryland Medicaid. This includes the Family Supports Waiver, which supports children birth to age 21. This waiver includes a variety of support services for when the participant is not in school. It also includes the Community Supports Waiver. The Community Supports Waiver supports children and adults. New applicants to the program would need to meet the requirement of being 18 years or older. And this waiver includes a variety of meaningful day and support services. And finally, the third waiver program that the DDA operates on behalf of Medicaid is the Community Pathways Waiver. It is supporting children and adults, and new applicants would meet the criteria of being 18 years of older and in need of residential services. This waiver includes a variety of meaningful day, support services, and residential services. Next slide, please. So as we begin to talk about the waiver, we wanted to provide some information about the structure of the actual federal waiver application. It includes various components referred to as appendices, in total 10 of them, which will focus on different parts of the waiver service, the program, and service delivery. So as you'll see on this slide, Appendix A is specific to the waiver administration and operations. So it'll talk about The program components, including the coordinators of community services, our providers, and our structure. Appendix B is related to participant access and eligibility. In this section, you'll see information about the targeted group. In our case, individuals with intellectual and developmental disabilities. It'll also talk about the number of participants that the program can support, and if there's any special, what we refer to as reserved categories of groups of people to support. It'll also talk about the specific Medicaid eligibility requirements, and that will relate to some financial information, and also the level of care for which our programs are based on people needing to meet the standards of a high level of need for intermediate care facilities for people with intellectual and developmental disabilities. Appendix C is a very important area. This appendix has the most information related to participant services. For each service that the program offers, this appendix will provide information about the scope of the service, any specific requirements for that service, limitations, service delivery models, meaning whether it's available under our self-directed model or our provider-directed or traditional model. In addition, it has information related to staff and provider qualification requirements. Appendix D is specific to person-centered service planning and delivery. So this area will talk specifically about the person-centered plan, who develops it, who leads and directs it, and some of the processes. Appendix E is referred to as participant direction of services, also known for us as self-direction. So this will provide an overview and information about the components and elements and supports for people using our self-directed service delivery model. Appendix F is specific to participant rights. And so in this section, you'll see information about Medicaid hearings, case review conferences, and how complaints are addressed. Appendix G is specific to participant safeguards, and it'll have information related to medication administration and errors, restraints and restrictions. Appendix H is related to a brief overview of the program's quality improvement strategy. Appendix I is specific to financial accountability. It'll talk about rates and methods related to payments and audits. And Appendix J is specific to cost neutrality demonstration. It'll include a 5-year projection for each program related to projected service use by participants and the costs associated with it. Next slide, please. This slide is a chart of the various DDA waiver support services. It includes a variety of services and supports, such as assistive technology, behavioral support services, environmental assessments and modifications, personal supports, respite, and others, as noted on this slide. The X noted under each waiver program indicates the service is available in that specific waiver program. FSW in the chart is a reference for the Family Supports Waiver. CSW is a reference for the Community Supports Waiver. And CPW is a reference for the Community Pathways Waiver. Next slide, please. This slide is a chart of the various DDA waiver meaningful day services, which includes employment services, supported employment, employment discovery and customization, career exploration, community development services, day habilitation, and medical day care. These services are offered under the Community Supports and Community Pathways Waiver only. Next slide, please. This slide is a chart of the Community Pathways Waiver residential services. They include supported living, shared living, community living group homes, and community living enhanced supports. The Community Pathways Waiver is considered a comprehensive waiver that includes these residential services. Next slide, please. So now we're going to talk briefly about the waiver renewal requirements. Next slide, please. All Medicaid waiver programs must be approved by the Federal Centers for Medicare and Medicaid Services every 5 years. Once approved, they are effective for a 5-year period. Requests to make changes to a waiver program are made by submitting a waiver renewal or an amendment to CMS. Next slide, please. To support, a 30-day public input process is one of the requirements by the Center for Medicare and Medicaid Services for waiver renewals and amendments. The official public comment period for our waiver renewals is from September 6, 2022 through October 6, 2022. Public comment can be submitted to the DDA dedicated email address at wfb.dda@maryland.gov or mailed to the DDA Federal Program Unit at 201 West Preston Street, 4th floor, Baltimore, Maryland, 21201. To support the stakeholder input process and minimize public burden, comments for all 3 waivers should be submitted together under one response. Meaning if you have a comment or feedback that you want to make, it will be considered for all 3 programs. There is no need to submit the comment 3 separate times for each waiver. Next slide, please. To help identify proposed changes that we are making, the DDA has created track change documents for each waiver program and for each appendix. The same rules and requirements are used across the 3 waiver programs and appendices. The DDA has established dedicated renewal pages for you to view these proposals. We've included links for these dedicated pages on this slide so that you can view them. All track change documents are available and live today, so you can view them today. Next slide, please. Now we're going to start to provide a brief overview of the waiver renewal and provide some examples, and then we'll get into the specific appendices and share some of the things that you're going to see when you review the proposals. Next slide, please. First, before we get into those details, we wanted to share that prior to the development of the renewal, the Developmental Disabilities Administration and the Office of Long-Term Services and Supports reached out to the Maryland Developmental Disabilities Coalition and the Self-Directed Advocacy Network of Maryland, Incorporated, for input on suggested changes to the waiver program. Their input was considered as part of the renewal process. This slide notes the membership of the Maryland Developmental Disabilities Coalition, which includes representation from People on the Go, which is a self-advocacy group, the Maryland Developmental Disabilities Council, the ARC of Maryland, Maryland Disability Law Center, and the Maryland Association of Community Services, which is a provider association. Note that the Office of Long-Term Services and Supports is Maryland's Medicaid office within our department. Next slide, please. During the 2022 legislation session, the Self-Directed Act of 2022 became law. We provided a reference to the House bill and Senate bill with links so that you can review the information if you're interested. Waiver requirements of the new law were also noted in the renewal application proposal, and we'll touch on some of those today. Next slide, please. So to provide a brief overview of some of the changes that we've made, this slide provides some information related to some of the appendices that are coming in the upcoming slides. The renewal process includes changes to increase flexibility, enhance services and supports for individuals and families. They also include some changes to staff qualifications, such as the removal of the requirement to have a GED or high school diploma. Each program has a limit to the number of people that can be served within the program. We refer to this number as program slots. We have increased the total number of program slots for the Community Supports and Community Pathways waiver. We have also increased some of the reserve slots to support transitioning youth in the Community Supports waiver and people associated with courts or state funding. We have also updated and reordered some language to better clarify, and we'll be moving some information to policy or guidance. We have also added information related to the new Quality Improvement Organization, referred to as a QIO, that was shared last Friday during the Deputy Secretary's webinar. Next slide, please. So now we're going to provide some overview, some information related to the main and Appendix A, which is associated with the waiver administration and operations. Next slide. The renewal proposed effective date will be July 1st of 2023. This ensures no gap in services as the current federal approval ends on June 30th, 2023. In the brief waiver description section in Appendix A, we included information related to being a technology-first state. Assistive technology supports and services allows Marylanders with disabilities to enhance their functional independence and support their self-defined goals. The first initiative under assistive technology is to provide information regarding assistive technology resources as the first option of community supports. During the month of August, Secretary Beatty from the Maryland Department of Disabilities and the Deputy Secretary Simons announced the kickoff of being a technology-first state. Next slide, please. In this appendix, you will also see that we've updated information related to contracts associated with the administration and implementation and support of the waiver. Contracted entities were updated to include Provider Search Directory, which relates to a web-based searchable database of DDA's providers and support brokers by service, location, and waiver program. It also includes information about person-centered planning, training, and system enhancements, contracts associated with positive behavioral supports implementation, training and capacity building, and also our new Quality Improvement Organization, or QIO. Next slide, please. So now we're going to talk about Appendix B, which again relates to participant access and eligibility. Next slide, please. In this appendix, you'll see some updates related to the program capacity. We have increased the Community Supports waiver and Community Pathways waiver total program slots. Again, we have increased the state-funded and court involvement reserve categories based on trends in recent years. We have also expanded our military families reserve slots to support military families who moved to Maryland. This was a suggestion we had received from Parents Place. We have also noted that all individuals determined to meet the crisis resolution category are offered the opportunity to apply to the waiver as per current practice. Next slide, please. Now we're going to provide some overview of some of the proposed changes for Appendix C related to participant services. Next slide, please. Appendix C is the largest document and includes information related to the various services. Under the Community Pathways waiver, there are more than 50 service options that are available. This appendix includes that service description, service requirements, limitations, if applicable, self-directed options, and staff and provider qualifications. For employment services, we have removed the 10-hour per day limit associated with employment services for ongoing job supports. For career exploration, we have clarified that facility-based supports can be provided at an off-site location in the community. Next slide, please. For supported employment and employment discovery and customization, we have removed the end dates. Due to the longer transition for providers to move to the LTSS Maryland DDA module fee-for-service billing, the current end date of June 2022 is being removed. Providers that have not transitioned to the new employment services can continue to provide authorized services and bill through the current PCIS2 system. As provider services transition the billing into LTSS Maryland, the supported employment and employment discovery and customization legacy services will end, and the new corresponding services, meaning employment services, job development, employment services, ongoing job supports, and employment services discovery will begin. Next slide, please. For community development services, we have updated the group size to more than 3 participants to align with the current practice and rate assumptions. For day habilitation, we remove limitation for services being provided Monday through Friday only to allow more flexibility for supports that meet participants' needs. Next slide, please. For environmental modifications, the limitation was increased to up to $50,000 to support accessibility needs and higher costs for labor and materials. The current limit in our program is up to $15,000. Next slide, please. For housing support services, we have added that this service can include assistance with bill-paying services, such as sending monthly rent payments to landlords, sending payments to utilities, etc. This was another suggestion that we had received from one of the providers. We have also increased staff qualifications related to housing support services staff to have a bachelor's degree and have training in creating budgets with individuals with developmental disabilities. Next slide, please. In terms of nursing support services, we've removed references to the legacy services that were previously ended. You may recall that the programs used to have 3 separate services that were combined under a previous amendment. So nurse consultation, nurse health case management, and nurse case management and delegation services will be deleted because all those services now are noted under the nursing support service. We've also noted those limitations from those legacy nursing services to the nursing support services. In addition, we have specified that nurses must attend all DDA nurse meetings to ensure updated information and training. Next slide, please. In terms of personal supports, language was added to clarify personal supports includes overnight supports. We have also removed the GED or high school diploma staff requirement. Next slide, please. For respite care services, we have clarified that this service can be used as an emergency backup plan for unpaid caregivers. We have clarified that camps include travel camps within Maryland and day trips. We've expanded the option for legally responsible person and legal guardian to provide service with safeguards for conflict of interest and misuse in place. In addition, we have added an organized healthcare delivery system as a qualified provider of this service. Next slide, please. For living caregiver supports, we have added the options for siblings to provide services. For remote support services, we have clarified that this service does not include electronic audio-visual conferencing software applications that are reliant on the participant to maintain the connection. Next slide, please. For our residential supports, under supported living, we have removed the GED or high school diploma staff requirement. Under shared living, we have clarified some information related to the level 3 assessed need. We have also added this service for self-direction, providing budget authority. For community living group home, we've also removed the requirement for the GED or high school diploma staff requirements. Next slide, please. For the transportation standalone service, we have clarified it can be used to support independent travel out of the state for a day trip. We've also clarified that person-centered plan service authorization limit applies to both self-direction and traditional service delivery models. In addition, we have removed the requirement for GED or high school diploma for the staff requirements. Next slide, please. For services that can be self-directed, Appendix C also includes clarification that the DDA provider application is not required for employee authority services. We've also noted an allowance for mileage reimbursement under the self-directed service delivery model to the owner of a specialized, modified, or accessible vehicle driven by an employee of the participant for the purpose of the participant engaging in activities specified in the person's person-centered plan. This is one of the elements that are associated with the Self-Directed Service Act of 2022 to support when the family member is allowing the staff to use their accessible vehicle in the delivery of services. Next slide, please. We have also clarified that support worker services are required under the self-directed service delivery model when a relative, legally responsible individual, represented payee, and guardian serve as a paid staff to assure proper oversight and quality assurances, as well as reduce conflict of interest. This is also an element associated with the SDS Act of 2022. We have also clarified that the definition of relatives includes child and stepchild. Next slide, please. For the individual and family-directed goods and services, this is a service that is only available under the self-directed service delivery model. This service was updated based on the Self-Directed Service Act of 2022. We have added additional details related to options, including a new day-to-day administrative support service. We have clarified items not covered, including ABLE accounts, exercise rooms, pools, and hot tubs, and we have removed the funding limit. Next slide, please. For support brokers, We have also updated the service information based on the Self-Directed Act of 2022. This includes expanding the service scope and clarifying that an additional 30 hours per month can be accessed using unallocated funding for extraordinary circumstances. Similar to other services, we have removed the GED or high school diploma staff requirement. Support brokers will still need to complete the required training by the DDA. I am now going to turn it over to Nova to share some more updates to the next appendices. Next slide, please.
Thank you, Rhonda, and thank you all for participating today in today's webinar. I'll be sharing updates on the next few appendices. So first, Appendix D is related to participant-centered services planning and delivery. This appendix includes information pertaining to service planning development, monitoring, and updates. It discusses who is involved in the person-centered planning process and supporting the person in creating the person-centered plan, or the PCP. Next slide, please. So some of the updates you will see in Appendix D include added language associated with supported decision-making, including that individuals may seek support with decision-making from a specific person or team of individuals, and that supported decision-making means a process by which an adult, with or without having entered into a supported decision-making agreement, utilizes support from a series of relationships in order to make, communicate, or put into action the adult's own life decisions. You'll see that we remove reference to individuals using the self-directed services model, use of the cost detail tool. Next slide, please. So Appendix E is related to participant direction of services. It explains what authority participants have to direct their services and how participants are supported in directing their services. Next slide. So some of the changes you will see in Appendix E are that it has been updated based on the Self-Directed Services Act of 2022. We make clear that participants have opportunities to make choices about and direct all aspects of their lives, including by choosing and controlling the delivery of waiver services, who provides the services, and how services are provided. The state requested Independent Plus designation, which indicates that the state shows a strong commitment to participant direction. You will also see added language associated with supported decision-making, and we clarified the use of the participant agreement for participants to direct some or all of their services. Next slide, please. In this appendix, you'll also see that we updated the projected number of participants that may choose to self-direct, and this was based on historical data. We clarified circumstances when a participant has authority to modify services, and we added shared living under a participant's budget authority. Next slide, please. You will also see in Appendix E language about the expanded role of the support broker, and we clarified that the cost of criminal background checks are paid by the financial management and counseling services agencies. Next slide, please. So now Appendix F is related to participants' rights and explains how participants' rights are protected. This includes Medicaid hearings, critical incident reporting, and complaints. Next slide, please. We did not propose any changes to Appendix F for this renewal. Next slide, please. Appendix G is related to participant safeguards, meaning medications, restraints, restrictive interventions. Next slide, please. So some of the changes you will see in Appendix G are clarification that the DDA's Director of Clinical Services will review unauthorized restraints or restrictive interventions on a quarterly basis. You'll also see clarification that the DDA's regional office quality enhancement nurses review statewide and region-specific incidents related to health and safety of participants, including all deaths, and that recommended training or additional alerts to address any concerns or trends that are identified. Next slide, please. So Appendix H is related to the state's quality improvement strategy, as Rhonda spoke about before. Next slide, please. Some of the changes you're going to see in Appendix H are added information related to the Quality Improvement Organization, or QIO. The Quality Improvement Organization will provide strategies that enhance the quality of life and help to ensure the health and well-being for individuals with intellectual and developmental disabilities. They will develop audit standards for the DDA services, including reviewing cases and analyzing patterns of services related to assessed need and quality review. They will be conducting ongoing utilization reviews to safeguard against unnecessary utilization of services and to assure efficiency, economy, and quality of care. And lastly, the QIO will also be administering the DDA's National Core Indicator surveys. Next slide, please. So Appendix I is related to financial accountability, meaning how the state makes payments for services and ensures integrity and accountability. Next slide, please. Some of the changes you will see in Appendix I are updated rate determination methodology, and that includes previous rates from the rate study completed in November 2017 have been revised and trended forward with a 9.5 CPI adjustment. We've added that the Maryland General Assembly mandated 4% cost of living adjustment was approved for the state for fiscal year 2020 to 2026. And we've also added that in April 2021, the DDA increased the rates in PCIS2 by 5.5% using savings from the American Rescue Plan Act of 2021. Next slide, please. Appendix J is related to cost neutrality. In its application and each year during the waiver period, the state must demonstrate that the waiver is cost neutral. Next slide, please. So some of the changes you're going to see in Appendix J are updated assumptions based on an analysis of federal reporting, enrollment, LTSS Maryland person-centered plan data, and self-directed participant service enrollment. You'll also see estimated service utilization that will reflect longer transition of service to LTSS Maryland fee-for-service billing. And you'll see updated 5-year projection of users, units, and estimated costs. Next slide, please. So Rhonda spoke a little bit about the public comment process, and on the next slide, if you want to turn to that, we have this listed for you. She said before, the official public comments period is from September 6th through October 6th, 2022. The track change documents of the waiver and all the appendices are available on each waiver's program's dedicated webpage, and that's listed on the next slide. Again, the public comments can be submitted to wfb.dda@maryland.gov or mailed to DDA Federal Programs at 201 West Preston Street, 4th floor, Baltimore, Maryland, 21201. And to be considered, all public comments must be submitted by 11:59 p.m. on October 6, 2022. As you can see here, the DDA has dedicated waiver renewal web pages where you can find these proposed waiver applications, then they're listed on this slide. If you are not able to click on the links, if you are able to click on the links, they will take you right to the web pages. But we also included the URLs so that if you're unable to click on these links, you can type it directly into your browser. Now I'm going to turn it back over to Rhonda.
Thank you, Nova. Appreciate your help in sharing this information today. So before we open for questions and answers, this slide provides information on some of the next steps. As Nova has shared, the public comment period is from September 6th through October 6, 2022. We encourage you to review the proposed changes and submit your input. We will review input and update our proposals as applicable. The Office of Long-Term Services and Supports, the Maryland Department's Medicaid office, will do a final review and approval of the final proposals. The Office of Long-Term Services and Supports will also submit the proposals to CMS on January 1st. The Centers for Medicare and Medicaid Services will conduct their review from January through June and follow up with the state with any questions. Again, the proposed effective date is July 1st of 2023. We're now going to open it up for questions and ask Patricia to assist us with the questions. Patricia.
Thanks, Rhonda. Appreciate it. So you have some questions in the chat box. I'm just going to go straight from the top down. And so the first question is, can you share who will be the contract monitor for the FMCS services?
Yeah, absolutely. Thank you for that question. We're really excited about our new financial management and counseling services, which is a support under the self-directed service delivery model. The Maryland Department of Health contract monitor is Monica Harari, and we can provide that information if you're interested. We also have a dedicated web page for financial management and counseling services on the DDA website, which includes a wealth of information about the providers, services, and guidance.
Thanks, Rhonda. The next one is with the waiver renewal effective date beginning July 1st, 23. Does that mean that none of the changes related to the Self-Direction Act are in effect until that date?
Yeah, that's a really great question. So there are some elements of the Self-Direction Act of 2022 that does not require a change or an update to the waiver program that we will be able to implement, and have been working with the self-direction or SDAN related to those. The elements in the waiver program would need to be approved for us to be able to implement other ones, such as removing the limit to individual and family directed goods and services, the requirement for a support broker if a relative or legal guardian and such is a staff member. Those ones we would need to make changes within the federal program and have the approval in order to fully implement.
Okay. What will happen if an existing housing support service provider staff does not have a bachelor's degree? Will they be able to continue to provide the services after the waiver renewal?
Yeah, that's a great question. The answer to that is no. The new standard for the qualification would become effective July 1st with the approval from the Center for Medicare and Medicaid Services. And so there's going to be that 6-month runway for us collectively to continue to provide information and technical assistance related to the upcoming proposed changes.
Nova, this question is for you. How will DDA ensure this information is shared equitably with people who are not on the webinar or access to the internet? Also, people who don't speak English as the first language or even second language?
That's a good question. Well, DDA does put out communications to folks who have signed up for those communications. And we have this information at all the regional offices, and the regional offices also share this information with folks in the waiver programs. If there is a need for us to provide this information in a different accessible format, we can also do that. We would just need a request for that to see what type of format that would be most useful.
And should they submit the information to the regional office or to the federal programs?
Well, if they submit it to the regional office can contact us and we can make that available to them. Or if they have this information, they can contact the email address that we've provided. And that is referenced every day. We'll be looking through that and compiling all the information we receive. And I can directly reach out to them if they send it to that email address.
Thank you so much, Nova. Rhonda, this is really a service question. I'm going to read it. It says, if an individual is with a provider not yet in LTSS and has a day of CDC, but needs for psychological or medical reasons to return to his residence, like supported living for 3 or 4 brief periods of 20 to 30 minutes, is the provider able to bill during these times? Or do they lose the funding for that?
Yeah, that's a good question. So if I'm understanding the question correctly, this person is receiving our community development services, and those services are designed to be supported in the community. Obviously, right now we're in a little bit of a different situation and have some exceptions to our requirements under the Federal Public Health Emergency Appendix K guidance. But in general, I would say the waiver does provide the opportunity for people to return home for brief periods in the event of medical, behavioral challenge or need where they may need a brief break for that, and that would be permitted. We can follow up and look to ensure that's noted in our guidance and confirm that.
Wonderful, thank you, Rhonda. Then this is another question. It says, this is the question people are asking, where can they find the Self-Direction Service Act of 2022?
Yeah, great question. In our presentation, we did include the links to the actual bills that were proposed and went into law. You can also search online. You go to the legislative dedicated website for the Maryland General Assembly and search on that to get that information. But we did include the direct links to both of the bills that are available.
Under the family support waiver, will there be accommodations for individuals to use additional personal supports and or community development hours when schools are closed throughout the year?
That's a really good question. So just to clarify, for the family supports waiver, it only includes the support services. Therefore, community development services are not an option available. And through the person-centered planning process, the family and the participant and the support of their team should look at the assessed needs for the whole year. Personal supports and services are available when school is not in session. And so that would be something to look at in terms of planning related to the needs for personal supports, for respite, and other supports that are available under the family supports waiver.
Thank you. Rhonda, do you want to talk a little bit about the changes? So the question is, once changes are updated and confirmed, will it be added into the waiver definitions? And how does that work?
Well, that's a really good question. So the documents that we're talking about today, each waiver program has what's referred to as a waiver application. So it's a template for which states complete to put in the services that they're going to provide, the service requirement, qualifications, how many people they're going to serve and such. So specific to the services, We have noted in our track change documents any edits or changes that we would be submitted to CMS that we're asking for your input on. Once we complete the input process and review the input that we received, then Medicaid, our Medicaid office will actually submit that within the Medicaid, within the CMS system, and it'll directly update the requirements for the service descriptions within the waiver applications themselves.
Thank you. This one is, people want to sure they heard correctly, is the CDC group size update. Is that referring to CDS 1 to 4 decreasing to 1 to 3?
Yes, absolutely. Based on information that we've been receiving from providers about group sizes that they're supporting, and in addition to some adjustments in assumptions, then yes, we are moving to a 1 to 3.
Right. Can you share which changes to self-directions are being implemented before 7/1/23 and when those will be implemented?
We are providing information and guidance related to self-direction. We are doing lunch and learns. We're also supporting our current effort for the transition to the new financial management counseling services, but we absolutely can coordinate and team up with SDAN and others to provide any additional clarification about options that are available today.
Okay, and somebody's asking, can they get this handout in Spanish? And I think Nova just share what they need to do. So Nova, do you want to just share a little bit again as to what people need to do to get in a different language?
Sure. I would say for any special accommodations, you can reach out to me at the email address that we listed, or reach out to your regional offices, and they, the folks who work with you, I think, can best provide an overview of this information or provide it in a way that's accessible to you. And if they are not able to do that, they can contact the headquarters, and we can work with them to make sure that you have all the information you need about the waiver renewal.
Thank you, Nova. Rhonda, this one's about remote support services. Clarify that the service does not include electronic, audio, visual conferencing software applications relying on the participant to maintain the connection. What does that mean?
That's a really good question. So remote support services are services that are provided to support people's independent living. So instead of having a staff person, remote support services can be utilized where there is a call-in system. There's assistive technology used so that the participant can access the remote support service provider in the event of emergency or assistance needed. And so what we're saying is that system that is put into place in the participant's home cannot be a system that requires the participant to maintain the connection, that the system needs to be fully functional and supported by the remote support service provider to ensure connectivity, access to that in the event of emergency.
This is related to support brokers, and it says currently the support broker role is for coach and mentoring. Will this broaden the role to assist the participant to create documentation such as policy, handbooks, budget modifications, etc.?
So that's a great question. As per the Self-Directed Service Act of 2022, the support broker role is being expanded to include all options that are available under the Waiver Technical Assistance Guide. And so using the person-centered planning process, the participant can identify supports that their support broker would be providing. And so we've got some additional information within the waiver track change documents so that you can see the expanded role and options that are available.
Okay, and this one is about the submission in the 30-day comment period. This person wants to know that after any changes DDA makes to the renewal, will this newer version be shared with the community stakeholders, providers, advocates before it's submitted to CMS?
Yeah, that's a great question. And as we have done with our practices of amendments and renewals, that we will update the track change documents and identify changes made as a result of the public input process. That will be uploaded to the dedicated renewal pages and as a second version, so that you'll be able to see, and a reference date aligning with the submission to CMS.
And this one's about the housing supports, Rhonda. I want to know if you can clarify again if a current certified housing support specialist does not have a bachelor's degree, are they grandfathered in, or will they no longer be able to provide the service?
The proposal noted in the application is that that would be a requirement. We did not include language about grandfathering.
Okay. The next one is about standalone transportation services be funded under two separate providers. Can this happen, like employment services and personal supports?
So to clarify, there's transportation needs to be viewed in terms of two different options. Within core services like personal supports and employment services, ongoing supports, rehabilitation, community development services, those services include a component of transportation within that service. That also means that there is a component in that rate that includes elements for transportation. The standalone transportation waiver service is to support a person who is independently going out in their community to the grocery store, to the YMCA, to activities. It also includes opportunities for specific travel training to support them to be more independent, and other options. And that service, as the standalone transportation waiver service, would be provided when a staff is not present with the person. And so that is separate than the services for personal support, CDS, and other meaningful day services.
Thank you, Rhonda. This one is about how many additional people will be served in the various waivers, and will these people be drawn from the current waiting list?
Oh, that's a really good question. So the specific numbers that are being increased for the total participants, or what we refer to as slots in our programs, is going to be noted in Appendix B. So the Community Pathways waiver will be over 16,000 over the 5-year period. And the Community Supports waiver, I do not have that number off the top of my head, but they will be noted specifically in Appendix B, which will list them. In addition to the individuals that will be supported, this will support people that we have what we call reserved categories for. So special spaces in our program to support our transitioning youth or our military families, people associated with the court, people leaving institutions under Money Follows the Person, emergencies for people unknown to us, in addition to people that would be determined on the DDA waiting list as crisis resolution. And then for situations where we're able to provide more opportunities, such as in our family supports waiver, we would then go further into the waiting list for crisis prevention categories and current requests based on availability.
Thank you, Rhonda. This one is, will there be a list of overnight requirements listed in the waiver renewal request?
That's another great question. So for personal supports, you'll see that we've noted information related to overnight supports, requirements for awake overnight or overnight supervision. We'll provide additional information in the actual policy to provide some more details.
Okay, this one is about support broker. It was mentioned that an additional 30 hours per month of support broker can be accessed using unallocated funding for extraordinary circumstances. Can you please define what extraordinary circumstances means? And do those additional hours need to be approved by the regional office?
Yeah, that's another great question. And so for the additional 30 hours, they would be used from the funding to support those 30 hours will come from the person's unallocated funding. So the DDA would not be authorizing additional hours in the person-centered plan. In conversations with SDAN and the input that we received, some examples of extraordinary circumstances would be a person may not have a support network, or maybe their support network is unable to continue to provide the level of support that they have, and then they would therefore be seeking additional hours through the support broker to help them in that expanded role. The request for the, I'm sorry, Patricia, the request for the additional 30 hours would not be reviewed and approved by the regional office. That would be the team process that we're using in terms of the person working with their team and a budget modification submitted directly to the financial management and counseling services. Please note that this additional requirement would not be effective until July 1st of 2023.
Wow, Rhonda, that's fantastic. That is empowerment, that is flexibility, and that is really good news to hear. Hopefully you guys are listening very closely to that. The next one people want to know about, will they receive the slides to this presentation? Please know that there are handouts attached here. If you go to the right-hand side of your computer, you can download the handouts for today. And if you cannot do that, just let Nova or Rhonda know, or Donna, and we'll make sure that you get them. The next one is, let me see, this one is, don't you think the reduced group size in CDS are more of a function of the pandemic? I have not heard any feedback that would indicate an interest or rationale otherwise to decrease the max group size.
Yeah, that's a great question. And so some of the discussion that has occurred in the various groups that help to inform the DDA related to potential changes into program or into the programs or the service requirements, such as the new rate review advisory group, the early adopter groups, the employment first group, also discussions with providers. It's been shared with us that services are being provided generally in a 1 to 2 situation, maybe up to 3. And so based on that, we were aligning that information.
Thanks, Rhonda. This one is a question about quality. And it says, is DDAs collaborating with any government private organizations to better assure that there will be adequate and quality direct support staff to implement and provide the services shared today?
The DDA is, the DDA along with, I would say, our system partners, so providers of services, advocates, are always looking at ways to support the direct support staff workforce. And so we at the DDA are always participating in national conferences, national discussions related to enhancing the quality and support of the direct support workforce. And I know that our partners, our advocates, our providers, people self-directing are also interested in exploring ways to enhance the supports for our direct support workforce.
Thank you, Rhonda. What does specify nurse mean and who determines it?
In terms of the nursing that we're talking about today for our nursing support services, we have a nursing standalone support service in addition to nursing being a component of some of our key services. such as our residential meaningful day services. Nurses that support people within the Developmental Disabilities Administration are provided training specific to delegation and the flexibilities that are available under our service delivery system. And our regional office nurses and QE nurses meet with these nurses that have been certified on a quarterly basis to provide information and updates related to latest guidance, policy, health trends.
Thank you, Rhonda. Can remote support services be used in conjunction with the community living group home?
Yeah, that's a great question. And so under the waiver and in our policies, we do provide the opportunity to provide that on a temporary basis as a person is transitioning from staffing to the remote support services. So yes, it can be provided in a group home environment, and some of the staffing can be there as you transition to the fully remote support services. In this situation, the provider's information in LTSS, where the indicator for overnight supports would be turned off, and the remote support services would then be utilized to support them if that's the best service that supports the participant and the others in the home. Please note that if there's more than one participant, all participants would need to be informed and need to ensure that that would meet all participants' needs.
Thank you. Rhonda, this is a question about someone, if they want to get a copy or have access to the waiver technical guide, where can they find it?
Oh, sure, absolutely. The waiver technical guide is available on the internet. If you want to send an email to the dedicated input response email address that Nova mentioned, is in the slides. We're happy to share that with you. You can Google CMS waiver application technical guide. The current version, I believe, is associated with January of 2019.
Great. This is about nursing again. What happens to an individual with a nursing need that cannot be delegated?
Individuals who need skilled nursing services would be supported through other Medicaid programs. The DDA services are based on a delegation model, and we provide nursing support services, not private duty nursing.
The next one is, can an option be offered in the waiver to accommodate a translation services to the participant plan if needed?
Accommodate translation services to the participant's plan. So my thoughts related to that initially is that coordinators of community services and providers should be supporting individuals as they discuss their person-centered plan in the planning meeting to include accessibility supports. If you're talking about a specific standalone service, that could be something that you could submit in your input.
Is transportation services included in personal supports?
Yes, personal supports includes transportation as a service within it.
Regarding assistive technology, who can people ask for more information on assistive technology and what is available for people?
Oh, that's a great question. I'm going to offer a couple things, and then Patricia, you feel free to add to this, but please note that the state of Maryland has the Maryland Technology Assistance Program. There is a great resource center in addition to other resource centers in different counties where you can actually go and talk to people, touch, feel, check out technology. You can even borrow them related to that. Our waiver service includes the opportunity for an assistive technology assessment, where a professional would do an assessment of the individual to identify the best technology to support their needs to be more independent. And Patricia, I'm going to ask you to add a little bit more about your thoughts related to how people can find out more about assistive technology.
Absolutely. As you all know, we are a Maryland Technology First State as of the 15th of this month. We actually have a person at DDA, her name is Stephanie Jones, that could assist with resources and connect you to all the things that Rhonda just shared. So, please reach out to Stephanie.Jones@maryland.gov, and she'll be able to support and connect you with some of those resources. And we also video recorded the kickoff where they share lots of good information and information about the vendors that came. So please reach out to Stephanie. The next question is, did you take into account the weight law that passed this year and how that might increase number of each of the waivers?
Yeah, that's a really good question. And so what this question is related to is recent legislation was also passed that requires the department to create a plan to reduce waiting lists for Medicaid home and community-based waiver programs by 50%. The report is due to the governor and the legislators on January 1st of 2023. So we did not consider the number into our proposal at this time because that plan has not been finalized or established. And so in the event that we need to change an update, we would do an amendment to expand our slots.
Great, thanks, Rhonda. This one is there a limit to how many individuals can be in self-directed services?
Oh, that's another great question. The answer is no. There is not a limit to the number of people who can choose to use the self-directed service delivery model. You will see in Appendix E, which is related to self-direction, that there is a projected number of people that may choose to self-direct. It does not limit the option to people. And so we have updated those numbers too, based on recent trends and growth into self-direction and what we're projecting for the future.
Thank you. Nova, this question's for you. And then Rhonda, you can piggyback too on that. But if a service calls for a staff to hold a bachelor's degree to deliver a service, is there a requirement to hold a degree in certain areas such as psychology, education, social work, or is the requirements they just have a bachelor's degree in any area and also the required training?
Thank you for that question. It depends on the service that's provided. And when you go into Appendix C, you'll see the provider qualification requirements under each service. Generally, the bachelor's degree would be in addition to any required training or competencies that would be required for that specific service. But you'd have to go into Appendix C because they're all going to be a little different. Rhonda, would you like to add on to that?
No, absolutely. No, that's correct. So it'll be noted within the waiver application or could be specifically outlined in the DDA policies, which are policies that are available on our website under the policy stat tab.
This one is kind of like a recommendation and a question. So will it be possible to have housing support services staff have a 4-year degree or equivalent starting in the next fiscal year instead of just having a 4-year degree requirement? Would the degree requirements be similar to CCS's?
I think that's a great comment, and feel free to submit that as public input into the dedicated email address.
Great. This is a CDS question. Can 6 participants be served with 2 staff in the same community activity?
Yeah, we get these questions, I think, from time to time. So CDS, if you have a staff member that's supporting 3 people, and another staff member supporting 3 other people, and they're in the community and happen to be at the same community activity, absolutely.
Rhonda, is it true that only people who need residential services can apply for the Community Pathways Waiver?
Yeah, that's a great question. And so the answer is yes. And to clarify a little bit more, remember our Community Supports Waiver and the Community Pathways Waiver both include the same meaningful day services and the same support services. So if a person does not need residential services, their needs can be supported in the Community Supports Waiver. If a person has a need for residential supports, then they would be supported in the Community Pathways Waiver because that's the program that includes the residential services.
Okay. Does DDA provide trainings on specific waiver programs? For example, a provider that is looking to provide supported living or shared living as a new service?
I would share, and Patricia, you can add, if a provider is interested in providing any of the DDA waiver services or adding new services, that they can reach out to the Regional Office Provider Services related to the process to do that. We do not provide specific training or information related to businesses being established and creating business models. We do provide our program requirements, standards, and policies for which the service model would need to be aligned with or comply. Patricia, do you have any thoughts on that?
No, I think you're absolutely correct. That's it. So what is the mechanism through which the public gives feedback to these proposed changes? I want to make sure I understand. What is that? Can you go over that?
Yep, great. Yep, great question. So the way the public input process works is that we're asking you to review the information in the track change documents, and you can share your input. We're looking for your thoughts, suggestions, recommendations, revised language related to the changes of the services and the waiver program. You would send your recommendations, so you would write them up and send them to the DDA. There are 2 options to do. You can send them to the dedicated email address. And Donna, if you could go to that slide so they can see the dedicated email address, or you can send written input through the mail to the Department of Health at 201 West Preston Street. So Donna, go back one more slide. Yep. So here you can see this is the dedicated email address, wfb.dda@maryland.gov, or you can mail it to the Developmental Disabilities Administration. It'll come to our unit. We are located at 201 West Preston Street, 4th floor, Baltimore, Maryland, 21201. The public comment period begins on September 6th and runs through October 6th. So you can submit your input at any time, September 6th through October 6th. And as noted, any comments that are submitted by 11:59, just before midnight, we will review and consider those.
Thank you, Rhonda. That was very thorough. Appreciate it. And
Rhonda,
leave it on this
also-
page here. Go ahead.
I just wanted to add to what Rhonda said that that stakeholders can submit just one response instead of doing it to all 3 waivers, and that response will be considered to all 3 waivers, because one of the things we're trying to do is create consistency across the board. So we don't need necessarily multiple comments on each of the waivers. As long as there's one, we will consider that for all the waivers.
Thank you, Nova. That's a really good point that alleviates people having to submit 3 different comments for all the 3 waivers. Excellent. The other one is, can school speech therapists make an assessment for assistive technology?
Yeah, that's a good question there. We have considered requests for assistive technology based on assessed need and used other assessment tools that or assessment reports from other professionals. I would have to refer specifically back to the waiver requirements to see, but if there was a recommendation, I believe our requirement is for an occupational therapist, we would accept that, but I would need to refer back to the waiver to confirm.
Thank you, Rhonda. And yes, this is being recorded and it will be available on the dedicated waiver page that Rhonda talked about. Rhonda, do you want to give them any other information about how to access the recorded information?
I'm sorry, Patricia, can you say that one more time?
They wanted to know, will this recording be available?
Oh, absolutely. And as Donna had shared at the beginning of our call today, this presentation is being recorded. It will be included on the DDA YouTube account. In addition, we will post the presentation along with the recorded webinar to each of the dedicated Renewal web pages. We've already got a space for them, and so we will get them uploaded as soon as it's completed and processed.
Okay. What is the process to change from CSW and CPW once residential supports are needed?
Oh, that's a really good question. So when a person has a new assessed need for residential supports, they would work with their team and specifically the coordinator of community services, who would then alert the regional office and submit a proposed person-centered plan to include the residential services. Based on that, then we would assess that need. Once approved, based on the assessed need, then an application would need to be completed for the community pathways waiver so that the person could be enrolled in that program and therefore disenrolled from the community supports waiver.
Okay. I think we read every question that we have in the question box. Rhonda, it's 11:26. Do you all want to start closing those out? And if anything comes up in the chat box, I'll read it.
Sure. First of all, again, on behalf of the department, we really appreciate everyone's time in joining us today and sharing your thoughts and questions. We will be, as we said, posting the PowerPoint presentation and the recorded webinar to the dedicated Renewal pages. As noted on the slide, there is a 30-day period for public comment. Please note we are starting it after the holiday so that there's actually a little additional time if you want to do some reading this weekend. We have included the track change documents that will show you exactly what edits we're making to the program. And we're interested in your input related to that and other suggestions. And you can submit that input. And again, feel free to be specific about the service or the details associated with it. That helps us to know what you're suggesting. And that can be submitted 2 ways. First, to the dedicated email address. And secondly, you can submit it to the department through the mail. So those are the 2 options, and that we are going to consider your public comments that are submitted from September 6th through October 6th. So again, thank you for the opportunity.
I missed the question, so let me make sure I get this one. And I don't want to miss it because I'll break every question here. Is the flexibility of the day service extension for weekends also applicable to CDS?
What a great question. So currently under the waiver program, there is no restriction for CDS being provided Monday through Friday only. That limitation is only noted under dehabilitation, and to provide more flexibility and support for participants and families based on their needs. We are removing that limitation again, which is only noted under the meaningful day dehabilitation service.
And as you're speaking, of course, is one more. For participants who currently do not have support brokers, is there an easier process to add a support broker in July rather than to revise a PCP?
That's a great question. If a person does not currently have a support broker, a revised PCP effective with these new requirements July 1st of 2021 could be used so that we can authorize the service within their plan. We can explore and consider other options related to it if people want to access unallocated funds for a support broker without putting it within their plan.
Okay, great. And then start coming in. If mom and dad is an unpaid broker, can they continue doing it?
If mom and dad are an unpaid broker, can they continue doing it? Yes, as per requirements noted within the waiver program, they can continue to do it. Please note the requirements in the program states if mom and dad are the support broker, then other staff and employees cannot be a relative. If a relative or the other legal guardian, legally responsible person, and others that we've noted in the proposed changes, then there will be, once the waiver renewal becomes effective and approved by CMS, a requirement for an independent support broker.
All right, it is now 11:30. So thank you, Rhonda, for the opportunity, and Nova for this wonderful information. Rhonda, go ahead.
Great, thank you, everybody. We appreciate your time.
Thank you, everyone.